It's 2 o'clock. What's going on?
2 o'clock. What's going
And it's Tuesday, April 28th.
April 28th.
And you're listening to and watching WLGR LaGuardia Web Radio. I'm your host of the show, Hugo Fernandez, What's Going On? And today my guest is Matthew Smith, who is the director of the Paramedic program at the Adult Continuing Education Division's Continuing Learning program. Sorry, I'm having some technical issues of my own right now, so I'm a little off. We're still learning the system of working on camera and off camera at the same time. But how did I do, Matthew? Was I even close?
Yes, that's perfectly fine. That's perfectly fine.
Yeah, I had everything.
Pleasure to be here, and thank you so much. Pleasure to be here, and thank you so much.
The paramedic program coordinator. That's the way I wanted to get it. I knew there were 3 words in that. I knew there were 3 words in that title. Very good. Very good. And I'm being told that I have an echo, so I don't know what that's about. So it sounds like when I speak, I have an echo. I don't know what to tell these folks. So if you're listening, today's show is about the program itself, and because we're finding faculty who are working in the school who teach our students, our paramedic students, are also now finding themselves in the field. And I'm being told now that everybody has an echo. So I don't feel special. But anyhow, our students are finding themselves in the field, front lines, and our faculty are finding themselves in the front lines. And when President Arcario was talking about this in the email, I thought, well, there's something that I'd like to be talking about here on today's show. By the way, today's show is dedicated to Dr. Louis Luca, the program coordinator for our speech communication program in the Humanities Department, and was one of the people who put together WLGR, actually one of the founding members as far as setting it up physically. And we're dedicating this show to him because he passed this morning. Sadly, and we still don't know the details. He had been struggling with some things for some time now. But I thought it was only right that we dedicate today's show to him. We're going to persist, and hopefully they can solve the echo issues from behind the scenes. So Matthew, and is that how I can? Would you like to be Professor? Would you rather Professor Smith? Professor Smith? We didn't talk about this before. You want to tell us a little bit about yourself?
Sure. Well, I guess
background.
Background. I'm a graduate of LaGuardia's Paramedic. I graduated back in 2012. I'm originally from Maine. Left Maine in 2005 to go to college. Went to college in Washington, D.C., and then came up to New York to attend law school. So while I was in college, I became involved in my college's emergency medical services program. And it was a student-run volunteer ambulance responding to emergencies on campus and in the surrounding community. I became really passionate about that. That was an interest that I kept up during law school. I got involved here. I went to NYU for law school. Got involved in starting a student-run EMS interest group, kind of delegations to send various volunteer ambulances in and around the city, getting experience doing patient care, helping out the communities around the city. So I kind of kept that up. I kind of kept that up while my legal training. And my last year of law school was 2012. And at that point, I kind of came to a realization that if I didn't training as a paramedic in that final year of law school, came to the conclusion that it would be unlikely that I would find it unlikely that I would to do it later in life, and I to do it later in life, and I came to another conclusion that was I wanted to be a part of my life. I wanted to be a part of my life, having been a paramedic, having been a paramedic. I enrolled in LaGuardia Paramedic program during my last year of law school. During my last year of law school, did the paramedic program in my last year of law school together. My last year of law school at the same time, which made for a very productive year. Made for a very productive year. And after that, it proved a lot easier to get work. It proved a lot easier to get work as a paramedic than as a lawyer. That was when the legal job market was in the legal job market was in fairly major downturn. Fairly major downturn. So I began working as a paramedic. In city's 911 system. City's 911 system up in the Bronx. I started up in the Bronx at a Montefiore hospital, and then. After that, I moved within about a year into a management position at the private ambulance company that was contracted to run those 911 units, and I stayed in that management position until that company unfortunately went out of business in 2016. And after that, in 2016, I was fortunate to have the opportunity to come back. To LaGuardia. To steward the paramedic program. I've been here since. And since, in addition to being here at LaGuardia, I work for a hospital that I won't name as a frontline paramedic in New York City. So I do the two jobs. When I'm not there, I'm at LaGuardia, and when I'm not at LaGuardia, I'm at the hospital. So makes for a busy life, but a rewarding one.
You're a model guest, because all I have to do is say go, and you answer. Maybe I prepped you too well.
Well, you know what they say: the most dangerous place in the world to be is between a lawyer and a microphone. So
I never heard that before.
Oh well,
it's
now,
funny.
Now I've said it. So
yeah.
Now you
have. Well, I am getting reports. If folks see me looking off to the side, because I'm getting reports that they're still struggling with the echo, though it came and went. So hopefully they'll figure out what's going on. So it's kind of fascinating because, though I say this to my students all the time, there are more people in law school than there are practicing attorneys. So it always is fab, because you do have the JD. So
I do.
Right, and but you found yourself, moving into this other world, and I guess you talked a little bit about that already. I guess the couple of questions, again, why the paramedic role rather than law, which I think you invested in probably just as much, if not more, right?
Yeah, trying to think about that too much. A few things. So, I think first and foremost, the plan for my paramedic training was that it would be a stopgap between graduating from law school and finding work as a lawyer, and it would enable me to be gainfully employed while I studied for the bar and looked for a position as a lawyer. It has become obviously much more than that for me, and predominantly the predominant factor there is just market forces, right? The healthcare employment market is incredibly robust. You can snap your fingers and find work as a paramedic, and it's much more difficult to find work as an attorney. As you say, there's the supply of attorneys far outstrips the demand. So I guess the first thing would just be a kind of a pecuniary concern of I need to have gainful employment, and this was the way to get gainful employment. But there's other things that drew me into EMS as a profession. So a few of those are a lack of moral ambiguity. So in law, generally for one party to win, another party must lose, and I never loved that. I love about medicine that everybody wants the same thing. Everybody wants good outcomes for patients. Everybody wants people to get better and for healthcare to be delivered well and delivered efficiently. And I love that about medicine. The other thing I love about EMS, particularly within medicine, is the immediacy. It's the opportunity to go see somebody who needs help and give them that help and see the results of your care right away. You know, if you're working on a case, it may be years or decades before it comes to fruition. Whereas, you know, if you are treating a patient, you can see immediate results. If we go to somebody who's overdosed, we can give them a medication and they'll go from not breathing at all to breathing again. And that's incredibly satisfying.
Yeah. It's interesting. I was going to say, when you talked about winning or losing, my ex-wife, who was an attorney, went into mediation, and there, supposedly both parties lose.
Yeah.
But anyhow,
Yeah.
so I guess then the next question would be, why LaGuardia to get the EMT or EMS training?
Well, what I'd like to say is that because LaGuardia has the best training around, which is true, and because the program is widely recognized as being the top in the city, which is also true, and because we do a better job of it here than anybody else, and that's also true. But the real reason, to be honest with you, is because my law school classes were generally in a block of like 9 to 5, Monday through Friday, and the LaGuardia program at the time took place in the evenings and on Saturdays, which was exactly when I was not in classes for law school. So the two kind of dovetailed together perfectly. I would go to my law school classes during the day, then literally go into the bathroom at the law school and change into my paramedic student uniform, like I don't know, Batman or whatever, and come out and I would go to my second secret identity as a paramedic student.
I see. I see. I'm in the C building, so I see them all the time.
Yep. So there you go.
Tell me, can you talk to us a little bit about the program, like how it works?
Yeah, I think the first thing to understand is the difference between an EMT and a paramedic, right? So EMTs get about a semester's worth of training, and they get a grounding in medicine, an introduction to what it is to be a member of the medical community, which is probably the most important thing they learn. You know, they learn what it is to serve a patient, what it is to assess a patient, what it is to treat a patient, and they kind of learn the very basic things about the kinds of medical emergencies that people can have, and the basic, mostly non-invasive treatments that are available. So as a paramedic, you take that EMT foundational training, which is about 200 to 300 hours, and you do an additional 1,200 hours of training. Now that 1,200 hours takes place over the course of a year, and it's split between classroom time, lecture time, and time in lab, and then the other half of it is clinical rotations, which take place in hospitals and on ambulances, and that's kind of where you do your applied learning. The program, I think the thing that stands out about it the most is how demanding it is. We want every single student to succeed, and we do everything we can. But even with that, it's an extremely difficult program, and our student retention is not nearly what we would hope it would be. And the reason for that is that there's just so much knowledge that must be absorbed in such a short period of time that it is just extraordinarily challenging. The students at the end of this have a level of responsibility that far outstrips the pay they get, and I think the general understanding of what it is they do. When these students go out in the field and work as paramedics, they are doing skills that in a hospital really primarily doctors are doing. So they're placing breathing tubes in patients' throats. That's a procedure called intubation, and that's generally done in a hospital only by a physician. Or certain very specialized nurses can do it, but primarily it's a physician skill. They'll do something called needle thoracentesis, which is reinflation of a collapsed lung. Again, that's a physician skill. They're administering via IV or via a catheter that's inserted into the bone. They're administering any of 50 or more drugs to patients. And they're frequently deciding on their own what the appropriate drug to administer to a patient is, and they're doing that by evaluating their heart rhythm, their oxygen level, their blood glucose level, all of these various kind of lab values, and it's circumscribed in scope, but these are the types of decisions that are generally done by physicians, and so we are teaching them in a way to bring the care of the emergency room to the side of the patient. That's been the kind of guiding paradigm for paramedicine from the very beginning, is to bring the emergency department to the patient. And so you know, as a paramedic, you kind of have to be chief cook and bottle washer in a sense, because you are responsible for patient assessment, for diagnosis, for obtaining all of the lab values and the vital signs and the tests that you need, for determining the appropriate course of treatment, for carrying out that treatment, and then at the end you're responsible for cleaning up and for returning the ambulance to service in a neat state. So you are literally everybody from the doctor to the janitor is a role that you have to take on at a different time in your day.
Yeah, like a rolling hospital. It's funny because when you were talking, it reminded me, you know, I'm of the age, I was a kid when that show Emergency first came on, and it was a novelty, the whole notion of the paramedic. And I always saw it as, you know, basically the way it was, you know, shown was that they were an extension of the hospital or the doctor's care, and they were, you know, closely talking on the radio and being told basically what to do, even though they knew the procedures in order to conduct them, but they were being say, okay, we'll give them this, give them that, and or now it's time to do this. But
so
in practice, I guess that's not really what happens.
Well, it depends. It depends. So that absolutely was the paradigm at the very beginning, was that you would transmit to a base station and you would get all of your instructions from the base station. And there's some places where it still kind of follows that model closely. But here in New York City, we have one physician for the entire city, which is served by 200 to 300 units at any given time. So what that means is that physician can't be formulating the treatment plan for all these patients, and doesn't. So we have a wide variety of what we call standing orders, and so those are interventions and medications that we can carry out and give to a patient without permission from the physician. They're considered a standing order once you've determined through your assessment that a patient falls into a certain diagnostic category. You then carry those interventions out on your own. So, you know, we started off in the 70s and 80s kind of on that Mother May I model. And then throughout the 90s and the early 2000s, we've transitioned to a more independent model. And that remains the paradigm throughout most of the country. But the interesting thing, and it's funny you bring that up, is that more and more with improvements in communication technology, like what we're doing now, video chatting, we have an opportunity to kind of loop back and involve the physician more in the care of the patient. And so there's this concept of telemedicine or mobile integrated healthcare. And what that does is it kind of marries the paramedic evaluation and treatment of the patient with, at the end, a phone call to the physician to have the physician's kind of review of what the paramedic has found and input in terms of the treatment plan. And that has enabled paramedics to deliver something closer to hospital care. And now, whereas at one point the standard of care for almost every patient was just to go to the hospital, now what we're doing is we are instead saying, is there a way to leave these patients home? One of the things I like to say is that a hospital is no place for a sick person.
Especially now.
It's impossible to get rest. There's all kinds of pathogens floating around. You're out of your element. You are in an uncomfortable bed, exposed to all kinds of strange people and diseases, and it's really not an ideal place to recover from whatever's going on. So if we can leave somebody at home, we want to do that. It's also much cheaper to have paramedics in the home delivering this care. So what we're seeing now is patients with certain categories of medical conditions like congestive heart failure or cellulitis are two examples. They'll have a paramedic visit them, and the paramedic will do various lab tests and kind of evaluate where they are, and and they'll consult with the physician, and in consultation with the physician, the medications will be adjusted, or they'll get a dose of antibiotics, or they'll maybe have a change in their diuretic medication, for example. And then they'll stay home, and so they'll kind of be admitted to the hospital. It would be a condition that would have required a hospital stay, and now they're kind of, instead of being admitted to the hospital, they're admitted to their home, and they're just having a paramedic come check up on them. And so that's kind of one of the exciting things that.
And this is this is before the what happened with COVID?
This is before what happened with COVID. Although I would say that COVID has seen a rolling back in some ways and an expansion in others. So we're doing home visits to do COVID swabs to test. That was a big part of the initial response, was sending paramedics out to test people for the virus. So that would be an example of mobile integrated healthcare.
We're going to take a station break in about 4 minutes, but I wanted to give you a chance to tell us, what are our students like in the program, the type of folks you get who go through the program? I mean, I know what our students look like for credit and through academic affairs. Obviously, you're working with folks who are adult and continuing education. What are the
we do have
like?
Some academic affairs students as well.
Right.
I should specify, you can do the program as an academic affairs student or a continuing education student. So both options are there. I think the first word I would use to describe our students is passionate. This is a program that you have to want badly in order to succeed in. You have to really care about what you're doing. It's tremendously challenging, as I've said, and it requires a tremendous amount of sacrifices. And the majority of our students, the median student for us, let me say, is working part-time or per diem. And some students work full-time or full-time with overtime through the program in order to make ends meet. This is a program that requires upwards of 40 hours a week between studying and other commitments for the program. And these are students that are working now 40 hours a week on top of that. So they're having 80-plus hour weeks. So they have to be passionate in order to make it through. And they are also compassionate in addition to being passionate. They are a group that cares tremendously about their patients. They care about doing the right thing. They genuinely want the best for their patients, and they've gotten into this field not to be served, but to serve. And so that's something they bring to the table every day. And I have just a tremendous amount of respect and admiration for each and every one of our students.
And you sound like you're very passionate about them.
Absolutely. I owe it to them. When I talk about all of the things that they sacrifice, all of the time that they give up to be a part of this program, everything that they do to succeed. Yes, it's to advance their own careers, but it's also to serve their patients. And at the end of the day, the financial reward is there, but there are much more efficient ways to make a living. And so at the end of the day, for these students, it's not about the money. It's not about what's best for them. It's about what they want to do for their patients and wanting to enhance what they can do for the people that they're serving. And I think it's a tremendously admirable thing to do, and they deserve my respect and my hard work.
All right. It's 2:29, and we're going to take a little station break here. This is WLGR LaGuardia Web Radio. The show is What's Going On. I'm your host, Hugo Fernandez, and today my guest is Matthew Smith, who is a professor in the paramedic. Well, he's the coordinator of the paramedic program here at LaGuardia through the Adult and Continuing Education division. And I wanted to, we did mention your NRP at the end of your name. NRP is?
Nationally Registered Paramedic.
Okay, very good. And you put that too, so you're a double threat, a triple threat now that you're an attorney. I mean, that you're a teacher as well. So let's talk about what's going on right now, which is, I guess I took this for granted that faculty are practicing paramedics in the field or practicing in the healthcare field. They are actually working out there, but also our students. So how did this all happen? Talk about that.
Well, yeah, so our faculty who teach in the paramedic program are all paramedics, and the majority of them are currently practicing. All of them, of course, have extensive experience, but the majority of them are still getting that experience on a daily basis. And then the students, to be enrolled in the paramedic program, as I mentioned, you have to be an EMT first. And so the majority of them all of them are EMTs, and the majority of them are earning their living as EMTs. They're on the front lines here. They are working for a variety of places, private companies, the fire department, hospitals that work with the fire department. They're responding to 911 calls. They're taking patients from one hospital to another. And it's been tremendously challenging. So to give you an idea, generally, our 911 system will respond to between 3,500 and 4,000 calls a day.
That's citywide?
That's citywide in a 24-hour period. On March 30th, we responded to 7,111 calls.
That's double.
That's double. I myself waited. Normally, it takes us 20 minutes or so to drop off a patient. On or around March 30th, I was working, and I waited 2 hours and 45 minutes to respond to a patient. To drop off a patient, because there were simply no beds available. So the system was under a tremendous level of strain. This is, I'm speaking to you right now from a hotel room. And the reason I'm speaking to you from a hotel room is because it's not safe for me to be in my home, because my wife has some chronic medical conditions that would probably make her very, very sick if she became infected, and because I could carry this virus home to her without ever knowing that I had it.
And that's not unique, because that's the story I've been hearing about nurses as well.
Yeah, anybody who's leaving their home on a regular basis is at risk.
Are essential workers.
Yeah. And that's the folks in the laundromat, and the folks in the grocery store, and the cab drivers, and everybody who keeps the power on and the water flowing and keeps the city running. So anybody who does that is at risk. The difference is, for us, we're going to people that we know have the virus, right?
Right.
And that's a double-edged sword, because if you know somebody has the virus, you can don the appropriate protective equipment and take the appropriate precautions to protect yourself. But on the other hand, you're going to somebody who you know is infectious and who poses a risk of passing the virus to you. So,
is this the only folks that the paramedics are going to people who have already we're sure that they have, or there are also people just calling because they're panicking and they think they're sick.
So 911 is a service that takes all comers, right?
Right.
So we're responding to people who have the virus. We're responding to people who might have the virus. We're responding to people who are panicking because they think they might have the virus. We're responding to people who don't have the virus and have a different medical emergency. We're responding to people who are just having plain old heart attacks or car accidents or other emergencies that still do happen. We're also responding, and this is important, to people who have chronic medical conditions and are struggling to get care, because any kind of elective or non-urgent or almost non-emergent care is being triaged down and postponed. So at the hospital where I work, at every hospital in New York City, not just the hospital I work at, all elective procedures have been canceled for over a month. So there are people who have feeding tubes or um, central vascular access or other kinds of devices or medical conditions that need kind of periodic treatment, and they're struggling to get that treatment now because any non-essential procedure is being postponed. So we're also going to those kinds of chronic illness folks who can't get the treatment that they need.
Yeah, I understand. I think a number came out as far as the number of deaths in the country have increased dramatically, and it's really hard to parse out what is a direct result of the virus and how much of that is the complications of trying to get health care for it as well. So this is all mixed into it as well.
It is, and it's also, this is a virus that behaves unlike any virus we've ever seen before. I mean, we have patients. Your normal blood oxygen level is 95, 100 or so. We have patients who are looking at us, alert oriented, talking like you and I, who have a blood oxygen level of like 60. And then you'll carry them out to the ambulance, and on the way to the ambulance, they will literally just stop breathing with no warning. On the other hand, we have people who have a normal blood oxygen level, a normal chest X-ray, and a positive, the positive COVID test, and they're developing massive strokes or heart attacks because this is a virus that is apparently causing what we would call coagulopathy, which is alterations in the way the blood in the body clots. And so we're seeing patients who are in their 30s or 40s getting severe strokes of the type that we generally only see previous to this in patients that are in their 70s and 80s or above. So this is it. Even if you know somebody has the virus, their cause of death isn't always respiratory failure, which is kind of what we think of. It could be a stroke or a heart attack. So it's an incredibly difficult thing that we're dealing with here, and it's affecting all ages, really.
I want to talk about
a scary thing.
Excuse me.
Go ahead.
Well, I just wanted to talk about how it's affecting, faculty and students themselves who are finding themselves. I mean, we've got students struggling with all kinds of issues with, being sick, family being sick, losing jobs, and meanwhile they're trying to stay in school. Your students are actually out there physically fighting the disease.
Yes.
And I know how my students are responding emotionally and psychologically in these things. What are you experiencing as far as the mental health as well as the physical health of our faculty and students who find themselves in the front line?
Well, I think the first thing I'll say is it's hard. It's just to leave your home safely is a lot of work. The washing of the hands, the taking off your uniform at the end of the day. I have a routine at the end of my shifts that I go through that takes me about an hour to decontaminate myself after working. So just there's a a physical difficulty of the physical steps that you have to take in order to work safely. It's exhausting. Decontaminating the ambulance after these calls takes a half hour or an hour because you're scrubbing every surface. You're spraying it down and you're wiping everything down, and so it's physically exhausting. Number one, the things that you're going through, and it's physically taxing. There's a tremendous amount of anxiety because this is now a situation. First of all, nobody of any age is immune to this virus from the effects. Anybody could get sick. Anybody could die at any age. So we are all, I think, a little bit on some level worried about our own health. And as we don and doff our personal protective equipment, we are all very cognizant of the fact that if we make a mistake, if I take my mask off and then then take my bouffant, which is the head covering, off, and I snap the bouffant, that could aerosolize particles in the air, and I could then breathe those particles in and then become infected. So, we talked a lot about the need for protective equipment, and I'm fortunate at my hospital that we have it, but even with it, if you make the smallest little mistake, you could become infected. And in fact, our healthcare providers are becoming infected at just horrifying rates. And so we're all trying to be as safe as we can, but you're being asked to walk a tightrope here. And, no matter how careful you are, it's risky to walk a tightrope. So there's the physical toll, there's the mental stress of walking that tightrope. There's also the fact that you come home, and this is a virus that has an incubation period of 2 to 14 days. So I could have made a mistake 2 weeks ago that I'll find out about tonight when I spike a fever. So even when you're home from work, kind of the stress doesn't end. If you're in combat, if you've been shot. When you're combating this virus, you might not find out that you've been mortally wounded for 2 weeks. So that makes it kind of uniquely stressful because it's a stress that persists. It's an anxiety level that kind of persists whether you're at work or not. There's constant concern, and I have to say I'm extremely fortunate that I have this hotel room. It's been very generously provided by my hospital and by this hotel, and I'm extremely grateful for that. And it's taken what was my greatest anxiety, which was the health and well-being of my wife, and been able to tone that down quite a bit. And it's I think created a much safer situation for her. But not all of my students have that. Not all of my students are benefiting from these hotels, and so there's students that are working 7 days a week, 12 hours a day, and then going home to hotels where they're surrounded by nothing but other healthcare workers, or going home to their homes and having to worry about bringing the
It's dangerous.
yes, and so then I think the final stressor that I would bring up is just the trauma of seeing so many severely sick patients. I'll give a, I'm not going to say anything too graphic, but I'll give a quick trigger warning that if you are somebody who has some healthcare related trauma, you might want to just put us on mute for the next minute. But I think people need to know what the reality is, and the reality is that the morgues at the hospitals have long since been overflowing. At every hospital in the city are refrigerated tractor trailers that have been rented and brought in, and the dead are literally being stacked one on top of the other. It is a a physical manifestation of the devastating toll that this virus is taking. This is not like the flu. This is not like anything else we have ever seen. This is worse than 9/11 in terms of the toll it's taking. I'll be sitting in the ambulance bay at my hospital, and I'll just see body after body get wheeled out to these trucks, and it's devastating. And it puts an image in your mind, and then you think you go to treat these patients, and you do your best for them, of course, but you have the thought always that one of those bodies one day could be you.
All right. We're at the last quarter hour, and I only say this because at this point I'm going to open up the show to questions that are being, hopefully will be fed to me by Jamie Riccio, who's monitoring the glitch stream. But that was a pretty heavy transition.
Sorry about that.
I don't even. No, it's fine. I mean, I was actually going to look up the numbers. One of the ways I've been trying to deal with this is I'm not looking at the news as much as I.
Yeah, neither am I. It's
and
funny.
So I don't know what the actual numbers are as far as deaths in the 5 boroughs for COVID-19 in the city. But I'm pulling up. So here's a few of the questions that have come in. So far, great audio this week. Well done. Okay, no, that's not. That's just a.
Glad to hear it.
So someone's saying my average load during medical school was 18 hours a week of academic time, 32 hours of clinical rotations for a year. Most folks have to work their time job on top of this. That's coming from Yos Hates You. That's his. I don't know if that's one of our students here. This one looks like Jamie Riccio coming up with a question for us, which is, what advice do you have for students and or faculty in your program who are out on the front lines right now? What about for those who would like to get involved in some way? What can we do to help?
So I think the first thing I would say is to anybody who thinks they want to get involved, are you sure?
Yeah, I was going to say.
Are you sure? Because definitely think twice. So the advice I have is establish routines, establish best practices. That's a term we use in medicine. So be thoughtful and careful about the things that you do when you leave your home to protect yourself, and the things that you do, just as importantly, when you come back in to keep your living environment clean and virus-free. And be thoughtful and establish best practices for ways to safely leave your home, do what you need to do, and return. And I'll give you an example of what I do. I will, at the end of my shift, I'll go to the bathroom in our locker room, and I will doff my uniform in a very careful way with my mask on, and I'll put it directly into a plastic bag, and I will put on clean clothes. I will go to my car. I'll change out of my boots into some clean shoes. I'll drive home. I'll come up to my hotel room, and I will immediately doff the clean clothes that I wore home, and I will immediately take a shower and change into a new set of clean clothes. And only then do I kind of go into the other parts of the hotel room that I have. And it's exhausting. It's tiresome. It's annoying. But these are the kinds of best practices that can keep you safe from a virus that is really quite infectious and quite dangerous. So that would be my advice. Is the other kind of,
how can they help?
How can people
help? I'm sorry.
No, yeah. The other thing I'll say is that a slow day is a safe day, and Anybody who's telling you to hurry up and don your PPE in the middle of a pandemic, even if it's for a 911 call, even if it's for a critical patient, needs to take a chill pill and take a step back and let you don your personal protective equipment, because you cannot help anybody if you are dead. And so your safety has to come first. And so, a slow day is a safe day. You take your time and you don the proper protective equipment. The next question you said was, how can people help?
Right.
Yeah. So I think one of the great things that we've seen has been the way the city has pulled together in terms of showing support for our frontline providers, for our frontline workers of all kinds, and that's been tremendous. It's been tremendous to know that people appreciate what we're doing and that the city is behind us. Been the well, at first I wasn't really sure how to respond to the 7 p.m. Clapping thing, but I ran into that a couple times while I was on an ambulance and we happened to be driving through some residential areas while that was taking place, and it was as cheesy and corny as it may seem, that was the bright spot of a couple pretty bad days for me. So that's appreciated. Just compassion is appreciated. Understand that if you know somebody who is working on the front lines in whatever capacity, they are seeing things that are horrifying. They are going through things that are horrifying. They have probably quite a bit of anxiety about their own personal safety, and so try to be patient with them. Try to understand that they may not be responsive. It may be hard for them to have a strong opinion about things that they might have been able to express an opinion on before. I was thinking this morning about, there's a story that I've heard about George Washington, where he was in Valley Forge and he was writing back to his brother at Mount Vernon, giving him instructions for how to fix up his home and how to paint the walls. And I was thinking that it's just that is incomprehensible to me, to be in the midst of a battle, and that's really what this is. Is it feels like a battle. I'm deployed away from my family. I can't see my wife or my 2 wonderful dogs whom I love, and I also love my wife, for the record, but I just had to get the dogs in there too. But I can't see them, and I and everybody else, were risking our lives, and that's that has an effect on you. It really does. So just compassion, I think, is an understanding. Even if you don't understand, just kind of listening and trying to understand what people are going through is appreciated.
It's interesting because it's almost as if you were channeling the questions that folks were asking, because Christina Alvarez is listening in, and she mentioned, did you say war zone ? Then Elizabeth Strike asked, how is Matthew taking care of himself, which I believe you kind of talked about. And then finally, how can we, as Christina Alvarez again asked, how can we as EMS workers look out for each other's mental health in this trying time as we are a community? It seems like you've touched on that as well.
Yeah, I think we all have an obligation to be on the lookout for signs that our colleagues may be struggling, or people that we know, even if even if you're not in the healthcare field. If somebody seems withdrawn or irritable or not themselves, that's something that you should take seriously. They've talked about kind of three waves of this virus, and the first wave was the patients that are infected with the virus, and the second wave is the people with chronic illnesses who are having their access to care compromised by the virus, and the third wave is the medical providers who are of course being directly impacted perhaps by being infected by the virus, but then also who are having to deal with the trauma of what we're going through. And unfortunately, this is a week where we've already had 2 members of our New York City medical community die by suicide. And I think that underscores the importance of looking out for one another and being the keepers of our brothers and sisters. And just if somebody seems like they might need help, we all need to take that seriously, and we need to tactfully and carefully and thoughtfully reach out to those people.
Well, I hate to say it, but we're out of time. And I wanted to give you an opportunity to, I don't know if there's anybody, any last things you'd like to say, or anybody else that you'd like to shout out to who's listening.
Just to my mom, I think she's on, and my wife as well. I'm sorry, Elizabeth, that I mentioned the dogs before you. Doesn't mean that I love you any less. And hi to my dogs, of course. And just to everybody else listening, know that we're taking this one day at a time, and all of us, we're doing our best, and we'll get through this together. We'll do the best we can, and we'll figure this out together. We are all greater than this virus.
Yes, thank you very much. Just what I would add is that you use the word compassion a great deal, and I talk to my students about that word. Whereas passion literally means to suffer, compassion means we suffer together, and we're certainly experiencing that now. But I just wanted to say thank you to my guest today, Matthew Smith, who is the Paramedic Program Coordinator for the Adult Continuing Education Program here at LaGuardia Community College, and who talked to us today a little bit about what our faculty and our students who are in that program are going through. And we want to say thanks to them for their getting a crash course, so to speak, in the field. And I want to thank everybody else for listening. And once again, to just say this show was dedicated to Dr. Louis Luca, who founded this radio station, was the program coordinator for our speech and communication program, and who died early this morning. And we want to say thanks to him for everything he did while he was with us. And we'll remember him. And we'll go out the way we came in. Thanks, everybody, for listening. This is WLGR, LaGuardia Web Radio. I'm your host, Hugo Fernandez, and this is What's Going On.